NJN News for Monday, October 6th. Attached to the $700 billion federal bailout was a little notice bill that's expected to help the mentally ill and people suffering from addiction. The Mental Health Parity Act requires insurers to provide equal coverage of mental and physical health services. Zachary Fink has the story.
This morning, the mostly elderly patients at Comprehensive Behavioral Health Care participated in a health group led by their program coordinator.
We're going to talk today about Alzheimer's disease.
The activities here are designed to keep those with mental illness engaged. Advocates say all too frequently the mentally ill have fallen through the cracks, although that seems to be changing as the baby boomers age and retire.
Our seniors now, which is me and the other people, people my age, are a little more tolerant and a little more understanding and a little more knowledgeable about mental health and are more likely to seek it.
Last week, Congress passed the economic bailout package. As it often happens, unrelated bills were attached to the omnibus legislation, including a mental health parity bill. In essence, it requires group insurance plans with 50 or more people to include comparable copays and deductibles for mental health services.
This is a monumental bill for the mental health community. The mental health advocates have been fighting for this bill for a number of years.
When the economic rescue package passed Congress, it was widely criticized for including pork barrel spending. That is, monies and grants for programs that had nothing to do with the $700 billion bailout. The mental health parity bill wasn't quite that, but it did have absolutely nothing to do with the bailout.
There's no pork in this part of the issue. There may be some pork on the Wall Street side, but I think the part that it's really the right thing to do.
Advocates for the mentally ill say primarily the law will help those who are struggling to pay for their treatment. It will also help change the perception of mental illness. Those with substance abuse problems, for example, will now have parity with those who have physical illness.
Most state plans, like New Jersey's, that do cover the serious biologically based illnesses, did not include substance abuse.
We reached out to some insurance providers to get their reaction to the new law. A spokesman from Horizon Blue Cross told us they are, quote, in the process of reviewing the ramifications. Zachary Fink, NJN News, Lyndhurst.